So please, my co-chairman, good friend, Franz-Josef, thank you very much for your participation.
Well, I think we had a very interesting session, and at least I've learned quite a lot. These are my conflicts of interest. This is just to remind you that the impact of a severe bleeding has about the same importance as the impact of myocardial infarction, and this is taken from the work of the ISAC group. And here you can see that if you have a myocardial infarction, the subsequent mortality is increased. But if you have bleeding, and in this analysis it was any bleeding, but it was mostly driven by the more severe bleeding, you can see that the impact on subsequent mortality was about the same. So really we need to take into consideration the risk of bleeding and not only the ischemic risk. And I think by now the cardiology, the interventional cardiology community has learned this. This is also taken into account in the new ADAPT guidelines, and you have seen this slide in previous talks, and in the previous talk by Jose. And you can see that in this guideline we always stratify according to bleeding risk, and the timing for ADAPT duration is very much dependent on individualized treatment decisions. And you can see that if you have a high bleeding risk, then there is a need to shorten ADAPT duration, and this is already acknowledged in the current guidelines. On the other hand, if the ischemic risk is very high, it may make sense to continue for longer than even 1 year. But if you take a close look, particularly in looking at the short durations, you can see that it's still a C. So it's belief, and there is lack of data. And therefore, it's really important that we have a lot of very interesting studies with the Schöne stent on short DAPT duration. And I think there is mounting evidence for an individualized DAPT duration. In this symposium, you have seen the data of the senior trial, which is really a landmark trial in this setting. You have seen the design of the POEM trial, which will look at 1 month's DAPT and have a historic comparator. There will also be ideal left main study, which will compare DAPT with for 4 months with Synergy to DAPT for 12 months with Xience. And there's also a very big trial looking at 3 months DAPTs in high-risk patients, which is the Evolve Short DAPT trial, which we weren't able to show at this symposium. Just to remind you that this study has just completed enrollment. It included more than 2,000 patients at 110 global sites, and it was included patients who were considered by the treating physicians to be at high bleeding risk. Age is a criteria, history of major bleeding, and then the patients were stopped at 3 months, and I'm very curious about the results of this trial. Now, I need to thank Boston Scientific for sponsoring this meeting. And I think that Boston Scientific has a real track history of a number of studies, a number of landmark studies, which included industry-sponsored studies, but also support for investigator-initiated studies. And this includes more than 33,000 patients, and the work is going on. And there are also a number of abstracts which I like to point out that you may look at, and some late-breaking trials. Maybe we will see each other there. Thank you very much for attending the session, and have a nice meeting.